Hello, Vania. Good afternoon.
Hello, Miss. Good afternoon.
Hi, how are you? How is everything?
Oh, today is rainy in Oruro.
Yeah, it's cold.
Very cold. Yes, very cold.
Wow. How was your work?
It's very busy, hard, and those days we change the hours, so it's very confusing to now. uh,
Okay, I understand. You are on emergency area?
Now I am in consultation.
Okay, general consultations?
Yes.
Okay, okay, Vania. Talking about last class, eh, I I want to try to imagine a patient who has an accident. Okay, imagine whichever situation you want with that, and you have to give explanations to his tutors or parents. Maybe it's a children or something like that. Okay, in
Okay.
order of what we saw last class. Did you remember?
Uh, yes, yes, Miss. Okay. I am afraid. Um, I am bad news for you about um, your child. Maybe. Mm, your child was in an accident. So we um, so, we uh, on in the hospital. In this moment, your child is in a in a bed. The hospital is is no. Mm, we realize some we ay, ¿cómo esto? We did uh, some exams, laboratories, and imagines imagine imagine logic exams too. And in this moment, your child is in observation, and we need um, some let's say some authorization
Okay.
for some tests, how they need, how she needs, or they need.
Okay. Okay, you have to give a diagnosis, you,
Mm,
or maybe you have to do your tests first and then you're gonna give them.
yes, I can. I can give some diagnosis, general diagnosis, how uh, TAC or traumatis,
Are you
traumatis
okay?
encephalic.
Yes.
Uh,
PCE.
it is it is yes, change.
Yeah, but that was good. Okay, continue. And then the management.
The management, yes. In this moment, pues we we are we are we are doing some tests, laboratories, and exam of TC, tomography, and
Yeah.
abdominal ultrasound.
Okay.
Ultrasound, yes. These exam, no, these exams are to discard some lesion in in uh, in more organs.
Okay. Okay, that's good. What was you said first? Cardioencephalic trauma. That was the
Yes,
okay.
cardioencephalic. No, okay, no.
Cardioencephalic
If it's cranial,
cranial.
encephalic.
Yeah. Yeah. I'm so sorry. I changed the words. I was
Yes.
head trauma.
Yes. Brain
Head
trauma.
trauma. Head trauma.
Yes.
Okay.
If the TC is pathologic, um, we will be your child would need a surgery. But the specialist in the brain um, will evaluate all the exams.
Okay, that's good because you said first a diagnosis, then the management, and you are introducing to the prognosis, right?
Yes.
Okay, continue.
Okay. Your child will need a surgery and and, and treatment for for a lot of days. It depends the the results of the exams and the evolution of the the clinic or the symptoms and signs of symptoms your child.
Okay, that's so good. And you only miss something else at the end. What else? What is the protocol to ask for questions,
Yes.
right?
Yes. Do you have any question about the this actual situation or some exams or some results? Give me now, please.
Okay, that's so good, Bunny. It's so good. Now I want you to imagine um, maybe a treatment for any kind of disease and a discussion treatment.
Okay.
Okay.
For example, about diabetes. Okay. In your disease, we have 3 points very important. One is the medicines with pills or insulin, in some case. The second point, no less important, is the diet in your everyday. And the third is physical activity. Okay, these 3 points they are very important, and is how a table with a three or four. How you say? I miss. How do you say? Las patas de la mesa.
Ah, let me check. I forgot about that. Mm,
Mm,
table legs. Come on.
the treatment is called the table leg. In some case, we compare with a car or old car, who is I don't say I conduce with 3 horse, and 3 horse go in a one direction. If the 1 horse go to the left or the right, the car doesn't advance. And this treatment is similar, because the 3 points, diet, medicines, and physical activity, can be in one direction. And the medicine, if they only take the medicine, the disease will be will be advanced, and
If you won't take the medicine, the disease will get better.
no, if you
You,
don't take
oh,
disease, don't better. Yes, don't better.
okay. It won't get better.
Yes, it would got better. In the diet treatment, you need eat and drink natural fruits, more vegetables, and we have a lot options in your diet. And it's very important that you understand your disease and the treatment. Because
Okay.
the treatment, diet, and physical activity is for you, for
Yeah.
you healthy.
For your
You
health.
for your health. Yes.
Yeah.
And you need walk, no, talk every day
Walk.
around walk.
Mhm.
Was it walk around the around 30 minutes every day for 10 days, for 5 days. And it's very important too.
Okay. That's a good explanation. Okay, Vania, that was good. Thank you so much. I will send you my questionnaire, please. Can you fill it for me?
Yes, miss.
Just in time. Okay, Vania, thank you so much. See you tomorrow.
Okay, miss. Bye bye.
Okay, take care. Bye-bye. Hey, Belen.
Hi, Miss. How are you?
How are you? You're busy.
Yes, yes.
I'm so sorry. Uh, okay, let's talk about last class topics. Okay, I want you to imagine any kind of disease you want, and please make an explanation of that, the whole procedure. Can you?
About any disease.
Any disease. I want the diagnose, the management, the advices, and the prognosis.
Okay, I will talk about multiple myeloma. Okay, that it's a disease that it's on the blood, in the mother cells of the blood. To be specific, in our bones, we have some tissue, and that tissue produce cells that are B cells. And when this disease happens, these blood cells are not being produced the way that should be. They are we can have anemia because the red cells, they're not produced and they are replaced with another things. We can see the calcium too, that it's really high, because if the first thing, or one of the first things we're gonna order is a TC scan, because on the brain, not in the brain, and the scalpel, and in the school, actually in the school, we can see a little points that indicate us that the bone is deteriorating. So it's gonna be one of the things that we're gonna ask for to confirm our diagnosis. For sure, we're gonna ask too to the hemogram. We're gonna see that it's we have the pallets or the plaquettes that are really low, and we can see also the hemoglobin low, or the corpuscular media hemoglobin low too, and that's gonna help us to confirm our diagnosis. Also, we can ask to discard another things about the the cells of red stem or red stem cells, or red stem Berg cells too. I don't know how they call it in English, to discard a lymphoma not Hodgkin or lymphoma Hodgkin, because the clinic is really similar. Then about another thing that we can do from the diagnosis is that we can do a biopsy of the medulla ósea. It's fine that way, medulla ósea. I don't remember.
Okay, continue. I will tell you now.
Okay. And we're gonna ask the patient to lay down in the bed, to move a little bit his body from the side, whatever side, if you want to do it in the left side or the right side. And then we're gonna of course, we're gonna do the asepsia, and then we're gonna introduce some anesthetic, and then after that, bone marrow. Yes, bone marrow. Okay. After that, we're gonna use a dispositive that has a needle that is this longer. Yes.
So long. Okay.
Yes, it's really.
It's a kind. I'm sorry. It's a kind of leukemia.
No.
Oh.
It's another thing. It's really similar, but myeloma multiple is another type of cancer.
Okay.
Then, okay, we're gonna introduce that on the spine, iliac spine. And well, even if we are have the anesthetic, it hurts a lot. The patient prefers that it hurts. And well, we're gonna try to hurry, but sometimes it's really difficult because as we have the calcium really high, the bones are really even a little bit strong, I don't know. And then we're gonna take the biopsy, and we can aspire some of the tissue of the bone marrow. And after that, we don't have to do stitches because it's a needle. And so we're gonna place some pads to do the hemostatic thing to not keep bleeding. And then we're gonna confirm with the diagnosis that is a thing that pathology does, but they see the cells and that things. And after that, the prognosis or the treatment. This is a disease that is never going to heal. The patient will die like in 5-10 years, depending of the treatment. Even if we can give them the best treatment ever, they're not going to live longer. It's gonna kill them slow and that things. But we can take a state of remission that's gonna help our patient, and that we're gonna do
They have quality life.
Yes, but it's incredible because in this disease, we don't do chemo. We give the patients a really high doses of corticoids. So that is gonna take the remission. We can do that, and also give a how can I say it?
Isn't that worse for their immune system?
What?
The corticoids. Isn't that worse? The corticoids for the system?
No, they help, but I think that the corticoids are the best thing that they ever create, because it helps in a lot of disease and that things. But it's gonna be like they're gonna have controls like once per week, and that things to see how they're going, because at the first they can produce a lot of diarrhea. The patient is gonna get scared. It's really bad. The patients feel really bad, but we have to combine that with a anti-cancerígeno. I don't know how to say it.
Yeah, anti-cancerine. I think it's almost the same. Okay, continue.
Okay, and we're gonna give that, and well, our purpose is to get the patient on remission. So I don't know, that's what I remember about that pathology. Anti-cancer.
Anti-cancer. Okay, that's so good. You give me the diagnosis, the management, you give me the prognosis, and
treatment.
You have to say, because you're explaining to a parent's patient, maybe, right? Do you have any questions? At least, okay?
Okay.
Just that. But that was such a good explanation. Believe me. Okay. Now, I can put you another, maybe in a gynecologic patient. Can you make a discussing treatment for any kind of disease in that area?
From gynecological, okay.
Yeah.
Okay.
Some
about
preeclampsia.
Okay. Okay, I don't know if we can say preeclampsia or that thing.
Preeclampsia, it's good.
Okay. I have to do the same like in Irma?
No, I want a discussing treatment. For example, we have this kind of treatment and we're gonna do this. But if it's not working, we're gonna do this.
Oh my God, okay, I'm gonna change of pathology of disease because I don't remember very much.
Okay. Or diabetes, or maybe depression. I don't know.
Okay, I remember one. In gynecological, ovario polycystic syndrome. Okay, if the first thing we're gonna do is to give them metformina for 90 days, okay? And that's, it's gonna help to regulate the menstruation because these patients usually present with amenorrhea, with hirsutismo, I don't know how to say it in English, with hirsutism, I think.
Hirsutism, yeah.
Okay, they also present acne and a lot, and that things. So the metformina, and also it presents that these patients doesn't have they have resistance of insulin. So that's the thing that is producing those things in the body of the persons that have this disease. So we're gonna start
I
with
cannot believe that. I didn't know that.
yes, they have.
Okay.
It also causes that when you eat, like it doesn't unit with the insulin and glucose, it happens that you're getting fat and you don't know why. So
Wow.
this person can be fat too. Okay. So we're gonna give the metformina for 90 days. And if it's not working, we're gonna give metformina plus ovular inductors. Inductores de la ovulación, I don't know how to say it.
Yeah, it's okay. Ovular inductors.
Okay, ovular inductors for another 90 days because this is gonna be a really hard hormone therapy because the person can experiment the symptoms that maybe they have when you're pregnant or when you have menopause. Like you're gonna feel the really hot sometimes, change of humor, that you're hungry, that you can't sleep, and a lot of things that happen when you're pregnant. And it's really important to take care of you because you can be really propense to get pregnant. So you have to talk with the sexual partner that they have to be really cautious or careful. Then after that, if it doesn't work even, it's gonna be surgery. So we're gonna do like 8 holes in each ovary to can help they can help your ovaries to produce the normal cycle of menstruation and that things. So that
Oh my God. I think it might have this kind of pathology, a friend of mine. So I will tell immediately.
yes,
Okay.
but that is it can change a little bit because we can have also the therapy with the anti-conception pills. But when it differ the thing that I talk to you to the patient that have this syndrome, but cursing with amenorrhea.
Okay.
Because there is another girls that have this syndrome, but they have like their cycles, but they are irregular.
Yeah.
But they have the cycles, so it depends on what is happening and when, how longer the cycles and that thing. So that.
Okay. Okay, Belen, that was so good. Such a good explanation. I will share with you my, uh-oh, my questionnaire, please. Can you fill it for me?
Okay.
And just let you know, it was preeclampsia.
Reclams. Okay.
Yeah, there you go. Okay, Belen, thank you so much. See you, if you can, tomorrow. Okay, don't forget that those are the last classes. And at the end, we're gonna make a test, okay? I will
Okay.
tell you tomorrow if you can do it. Okay?
Okay. Miss,
Take
bye.
care. Bye
Bye.
bye. Hi Ale, good afternoon.
Hi, Miss. Good afternoon. How are you?
Fine, pretty fine, thank you. Here it's cold. How about you? How is there, the weather?
I'm fine. The weather is very good. It's sunny. Today was sunny.
Okay, that's so good.
Miss, I have a question.
Yeah, of course.
I wanted to ask when are we having the test? Maybe the Friday?
The test is gonna be next week. I think by the 8th of April, more or less. I will look for that. But it is on the last class. I will tell you tomorrow, okay? I will tell you and your classmates with some instructions, okay?
Thanks, Miss.
Even with the date, because I don't have it in mind right now and I have to search for that. That's why I will tell you tomorrow, okay? Please.
Thanks, Miss.
Okay, then let's talk about last class's topics, okay? About explanation. I want you to imagine any kind of disease you want and make an explanation of that disease with the whole points we talked about last class. I mean, diagnosis, management, prognosis, maybe some advices, some health advices, and that's all, I think.
Well, I could have a patient with high cholesterol. And first I have to take some labs and tell him or her that the LDL is high and we have to take some changes in his life. And I have to tell you have to change your style of life.
Imagine I'm
Like,
your patient. Okay, tell me how would you tell your patient? That was good.
Well, Miss, you have to do more exercise and avoid fast food like, I don't know, pizza or hamburger, and you have to eat more fruits and vegetables, and better if you make some exercise every day, like 30 minutes of I don't know what you like to do, maybe play sport or go to the gym. You have to choose a sport or an activity you want to do.
Can I walk? I like to walk. Just
Yeah,
that.
it could work, but better if you make another exercises, like, I don't know, more harder, or
Okay, I understand.
yeah, if you don't do that, you have to take some pills because your levels of cholesterol won't get low.
Okay, I understand. Now, you tell me about the diagnosis, right? You know I have this kind of disease. Now, you tell me about the management, right? And what about the prognosis and some other advices? Oh, you already
Mm,
give me an advice. Maybe the prognosis.
well, Miss, if you do the changes in your lifestyle, then you're gonna be okay. Because in most of the cases, with exercises and good or in the change of the food, you're gonna be okay because the levels of cholesterol are gonna to get low. But if you don't listen to me, then the levels of cholesterol are gonna to be high, and we're gonna to or you're gonna to take pills in that case.
Okay, I understand now. And you missed something. That is, okay, do you have any other question? Right?
Yes. Do you have any other question?
Okay, yeah, don't forget about that. Remember, you are speaking to your patient. You're explaining the whole disease. First of all, you're telling what did you find. Then you're telling what are you gonna do with that. Then you're telling her that it can work, or maybe not so much, but only depends on the things she is going to do, right? And then
Yes.
have to ask, do you have any question?
Yes, is the most important part because the patient has a lot of questions.
Yeah, maybe it can be, or you have to do another thing. Okay, it was understood. I want you to repeat to me what you have to do in order to know if she does understood what you mean. Okay?
Yes, Miss, it's okay.
Okay, perfect. And I want you to maybe find a gynecologic patient. Okay, imagine any kind of disease, but in that area. And maybe you can make a discussing treatment. What does it mean? You have these two kind of treatments, and you can think about which kind of treatment will work better for the patient. That is a discussing treatment. Okay?
Yes, Miss.
Okay. Which one do you pick? Or did you choose?
Maybe chemotherapy.
Okay. It's for uterus cancer or something like that?
Yes, we were talking about oncology, right?
Gynecology.
Sorry, I didn't hear that.
Don't forget. That's why I was asking you if it was an uterus cancer. Okay, but it can be. It can be. Okay, that's good. Go ahead.
Well, we are talking about gynecology.
But it can
Um,
be, as we said, it can be an uterus cancer. So you are good in that place, right? You cannot move from the oncology part. So stay there and tell me, what did you find? What is your idea? I want to know.
no, it's gynecology is okay too, but I have to talk about treatments, right?
Right. A discussing treatment. You have two or more kind of treatments for one disease. You have to make a discussion of what it will work better.
Mm, well, maybe in, I don't know, when I had a patient who is pregnant, I could talk about if she wanna have her baby by a natural way or a cesarean, and I have to check the baby's position. Maybe if he or she is in a transversal position, we have to make a cesarean. But there are cases where the patient have the possibility to choose, and some patients could ask a cesarean because they, they feel pain. But it's better to have the babies with a natural way.
Okay, so it depends on the case. You will choose one or another treatment depending on the mother's maybe situation. If it's young,
Mm,
if she's young or not, if she has babies before or not, maybe I don't know what else. What kind of things more you think about before you give the treatment in these cases?
mm, when a patient is pregnant, maybe.
Yeah, the age of the patient. What
Yes, the blood pressure, the age, um, the corporal, the weight, um,
Yeah.
yeah, AMS. I don't know how it could say in English. Masa corporal. Índice de masa corporal.
Let me check. I don't remember. Okay. Body mass index. I will write it. Body mass index. There you go. Okay.
Thanks,
So,
Miss. If my patient has another disease, I don't know, maybe she has diabetes or eh, or SIDA, or I don't know, we have to check that kind of things.
yeah, that's
Or
so you
maybe
have
she has chlamydia or I don't remember how it could be.
yes.
Mm,
How do you say in Spanish? I forget in Spanish.
I forget in Spanish too.
No, infecciones de transmisión sexual, right?
Yes, it's like because the patient could contagiar
It can be contagious for
or
couple of the patient.
yes, the patient could contagious.
It can be contagious for the couple of the patient.
Yes, the baby could get that diseases. So we can have to be careful with that.
That's right. Okay, we will still speaking. I just want you to fill please my questionnaire, Ale. And we're gonna continue talking about these topics. Okay, what else? Thank you so much.
That is the most important things we have to check.
Okay, ETS, I think it's the correct. Okay, I will check it for tomorrow. You can check it too, okay? And we're gonna find a better definition. I think it's ETS, but I cannot find the, the correct words to explain. Okay. Okay, Ale. What do you think about your advance? Do you think you are better than when you get into the course at first?
Yes, miss. I can speak more fluently or fluently before the beginning.
Yeah, that's true. I think you still have thoughts in your mind that you don't tell me, but you have to. You have to tell, you have to practice. Did you have the chance to practice with music?
Yes, I was listening music, but in my house, anybody talks English.
Yeah.
So it's a little hard to practice because anybody understands what I'm saying.
Yeah, it can be a problem. Another thing you can do is, I will send to you a link where you can get in and read some paragraphs, maybe a little paragraphs, okay? It can be, not, it's a little text. You have to read and you have the audio, okay? You press the audio and you can start reading while you're listening the audio. And then you will repeat it. And if you make a mistake, you will do it again and you can practice that way. Is that good?
Yes, miss. I will be so grateful if you do that.
Okay, let's do that then. I will send to you in a few minutes, okay? By inbox. Okay, Ale, anything else you want to add to this conversation? Or maybe
No,
some
miss.
examples, nothing else?
It's okay.
Okay, Ali. Then see you tomorrow. And tomorrow I will give you the date of the test and maybe tomorrow is the last class of this week. Okay, next week we're gonna have 4 classes, I think, more or less. I will tell you tomorrow, okay?
Yes, thanks, miss.
Okay, thank
See you
you.
tomorrow.
Take
Bye.
care. Bye-bye.
Okay, bye.